Depression, everything you need to know about it. Prevalence of depression in India is estimated to be 10 to 12%. According to WHO, 56 million Indians suffer from it. Additionally, India has one of the highest rates of suicide globally. Cause of depression can be combination of genetics, biological factors, environmental and psychological factors. Several factors contribute to the high rate of depression, including poverty, lack of education, and exposure to traumatic events. Mental health is still a stigmatized issue, and many people who suffer from depression do not seek treatment, which leads to underdiagnosis and underreporting of depression cases in the country. Access to mental health care is limited in many parts of India, making it difficult for those in need to receive proper treatment. Despite challenges, there is improvement in mental health awareness. How to identify depression? Clinical depression, also known as major depressive disorder, is characterized by a persistent and significant low mood or loss of interest in activities. Some common symptoms of depression are persistent feelings of sadness, hopelessness, and emptiness. Loss of interest or pleasure in activities that were once enjoyable. Changes in appetite and sleep patterns, like sleeping too much or too little. Fatigue or lack of energy. Feelings of worthlessness or guilt. Difficulty concentrating, making decisions, or remembering details. Thoughts of death or suicide. Physical symptoms such as headaches, stomachaches, and chronic pain with no clear cause. If you are experiencing symptoms of depression that are impacting your daily life, it is recommended to seek help from a mental health professional. How to manage depression? A proper diagnosis and treatment plan can help manage symptoms and improve overall well-being. It's a combined approach of proper counseling, therapy, medications, lifestyle changes, self-help groups, and community involvement, improving access to mental health and awareness. Depression is a common mental health condition that can greatly impact an individual's daily life. Counseling is a helpful form of therapy for people struggling with depression. Counseling provides a safe space for individuals to explore their feelings, thoughts, and behaviors, and work with a trained professional to develop coping strategies and improve mental well-being. Different forms of counseling for depression include cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and psychodynamic therapy. The type of therapy used will depend on the individual's specific needs and preferences. It's important to seek help from a licensed therapist to receive an accurate diagnosis and appropriate treatment. Cognitive behavioral therapy, CBT, is a type of psychotherapy that combines cognitive therapy and behavioral therapy. It is commonly used and found to be effective in reducing symptoms of depression. The goal of cognitive behavioral therapy, CBT, is to identify and change negative patterns of thinking and behavior that contribute to and maintain depression. Person work with their therapist to identify and challenge negative thoughts, develop more positive and balanced perspectives, and learn coping strategies to improve their mood and overall functioning. It focuses on teaching individuals skills to manage stress, regulate emotions, and improve relationships, which can also help reduce symptoms of depression. CBT is often a brief, goal-oriented form of therapy and typically lasts 12 to 20 sessions. Regular visit to counselor is needed to get desired outcome. Interpersonal therapy, IPT, is a form of psychotherapy that focuses on improving a person's relationships and communication skills as a way to alleviate symptoms of depression. IPT recognizes that depression can be due to problems in social and personal relationships such as loss of a loved one, conflict with others, or difficulty adjusting to changes in life circumstances. During therapy, individuals work with their therapist to identify and address specific interpersonal issues that may develop skills to improve their relationships and communication with others. The therapy focuses on building social support, improving relationships, and resolving conflicts. It is typically time-limited, lasting 12 to 16 sessions, and is often used in combination with medication for the treatment of depression. The choice of medication prescribed by specialists is guided by clinical assessment, severity, stressors, patient's preference, and anticipated safety and tolerability, which aid in compliance. Usually, 2 to 12 weeks at a therapeutic dose, with assumed adherence to the regimen, are needed for a clinical response to become evident. Moreover, in all patient populations, the combination of medication and psychotherapy generally provides the quickest and most sustained response. Combination therapy has also been associated with significantly higher rates of improvement, increased quality of life, and better treatment compliance, especially when treatment is needed for 3 months. Lifestyle changes in depression. Lifestyle changes are simple but powerful essential components of integrated management. The more you ensure to incorporate healthy mind and body practices, more you will be able to cope with symptoms. Sleep is interconnected with mental health. Regular schedule of 7 to 9 hours of sleep is necessary to replenish neurotransmitter to maintain brain functioning and mood and can alleviate anxiety. Exercise has been proven to be an effective way of reducing the symptoms of depression and improve overall mental health. It improves physical health, but it also has a positive effect on mental health. Exercise releases endorphins, which act as natural painkillers and can help reduce stress and anxiety. Regular exercise can improve sleep quality, provide a sense of accomplishment and self-confidence. Exercise and yoga for 30 minutes per day for 3 to 5 days per week may increase resilience to stressful stimuli. Exposure of few minutes of fresh air and sunlight can boost mood. Being the most metabolically active organ, brain needs constant stream of nutrients to function. Poor diet does not provide nutrients to produce neurotransmitter, which may provoke anxiety. Advised to eat healthy diet including fresh foods, plenty of water, probiotic supplements, cut sweetened beverages such as tea, coffee, soda and fruit punch, reduces caffeine-containing drinks. Alcohol, smoking and other addicting substances may worsen anxiety and depressive symptoms. These may worsen sleep by disrupting natural sleep cycle, resulting in feeling of restlessness. Meditation practice to concentrate on our own thoughts and emotions without judgment breaks the negative thought process, which results in sense of relaxation and inner peace in your life. Studies have shown that regular meditation can reduce symptoms of depression, such as feelings of sadness and hopelessness, and even help prevent future episodes of depression. Support group. They provide a safe and supportive environment where people can talk openly about their struggles, share their experiences, and learn from one another. Self-help groups can also provide members with access to professional counselors who specialize in dealing with depression. By connecting with other people who have similar experiences, those struggling with depression can find comfort in knowing that they are not alone. Additionally, the support of the group can help individuals to build self-confidence and develop coping skills for managing their mental health. Social support and relationship. Social support can be an incredibly powerful tool in helping to manage depression. By connecting with others who understand what you're going through, it's possible to reduce the severity of symptoms and create a sense of companionship and comfort. Stress and anxiety is a part of life, but chronic, long-term stress can lead to symptoms of depression. Stress builds upon itself, so it's essential to combat with calming, soothing experiences. Sleep, diet, exercise, yoga, meditation, avoid addiction, maintaining relationships, religious involvement, interaction with nature, traveling, Mindfulness music can provide aid to cope with symptoms. Engaging yourself in various activities like music, hobby, reading, positive attitude toward life, avoid loneliness or being alone. Proper counseling with professionals can be helpful. Thank you.